We turn to Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases. He is on the front lines here in the U.S. response to the coronavirus.
When the current coronavirus pandemic started in the year of 2019, not much was known about the disease. Because of this, healthcare workers risk their lives every day to save others who have gotten sick from COVID-19. I interviewed both Angeline and Krystal to see what their experiences were like while working on the front line during the current pandemic as nurses.
My name is Angeline. I am 24 years old and I've been a registered nurse for a little bit over a year since December 2019. I went to Biola University and I did their 5-year nursing program there, and then I graduated with my BSN, my bachelor's in nursing. I knew I wanted to do something within the medical field. I just wasn't really sure which path to take after I graduated high school, but my older sister became a nurse before me, and when I was applying for schools, I applied to one and last minute and I got in, so I just felt like it was the right way to go. And I really like that you're able to help people, and the job schedule is flexible, and there's a lot of diversity within the career, so I really liked all those aspects about the work.
My name is Krystal. I'm 26 years old and I have been a nurse for about 4 years, and my experience is emergency medicine. Growing up, I was surrounded by a lot of healthcare professionals, and I was fortunate enough to observe them. And it inspired me to also want to join the healthcare profession as well. What made me choose nursing was I like the fact that it is so widely used and the opportunities out there are limitless, and I felt like it was my way to contribute back to the world.
When COVID first came out, I was still a pretty new nurse. I had only been working on the floor by myself for like about a month, and then the pandemic hit in March. So I was pretty much learning how to be a good nurse, like on my own, as well as trying to deal with the pandemic. There was like a really big learning curve our hospital had to go to. The doctors were still kind of figuring out treatment day by day, so all the medications that patients were taking were like changing day by day, just as the news and the research came out. But the scariest thing is that a lot of these patients come in like super sick, like they can't breathe, and it was hard to kind of realize like you can't really save all of them. Some of them make it, but some of them the virus just hits them too hard, and we kind of just have to lay them to rest peacefully. So being a new nurse and trying to learn all of that really quickly in a really short frame of time was kind of hard, and our hospital was really understaffed at that point, and there was a lot of patients to take care of and not enough nurses, and a lot of nurses left because they were scared. And then some of the nurses got sick with COVID. Now that the surge is down, we don't have a lot of COVID patients anymore. I just feel better prepared now. Now I know what to expect. But yeah, it was pretty difficult the first time around.
On top of like the patients that we normally see every day in the ER, just trying to take care of them as well as all these COVID patients, it really put a strain into the hospital systems. And the biggest struggle that we are going through, in my opinion, is that we are just so burnt, just, tackling and fighting and just trying to take care of our patients.
I would come home so scared for my parents because they're in a higher risk age group, and this is before the vaccine came out. Seeing all the news and everything, it just made me so appreciative of all the healthcare workers that are working, how people are still willing to go to work and help treat these people. I've definitely became really appreciative of all the scientists who are continuously doing research on pandemics and viruses, that we were able to create such a response in such a short amount of time. But yeah, I think it just made me more thankful for for life in general. I remember the first time I got a COVID patient, it was definitely nerve-wracking, but thankfully my hospital wasn't really short on the personal protective equipment, so we always had our N95s and our gowns, and I know some hospitals didn't have that luxury, so I did feel protected. I was more so scared for if I were to contract the virus. I was more scared for my parents or any older people that I would come in contact with, because I know my age group has a better chance of faring the virus. Due to COVID, I always wear a mask before I leave the house, and I wear it all the way straight into the unit. Another thing that I wear is we all wear scrub caps now to protect our hair, but pretty much everything else is the same. I wear the same scrubs, but just the mask and the scrub caps would be different that I put on every morning.
At home, I try to minimize my interactions with my family members. So when I get home, especially if I just came back from work, I just stay in my room and just to keep my distance.
One thing I do is I take off all my scrubs before I touch anything, and I dump them in the wash and put them in the wash immediately. There's not really any way to know if you've contracted the virus that day, because the symptoms don't really manifest for a couple of days. So good thing our house kind of has separate rooms, so we're able to, if one of us were able to get sick, we were able to isolate at home. But just wearing my mask all the time if I'm outside, and N95 if I'm at work, it seems to be pretty secure and keeping me not infected. So I think mask wearing is probably the most important thing I do to help keep my family safe.
Due to how healthcare workers on the front line, like Angeline and Krystal, see many people struggling for their lives while at work, it has been crucial for them to have hobbies in order to take their minds off of work when at home.
It's nice because my job, I don't really have to carry any of the work home really, except for, just the emotional labor of it. So I do get the chance to separate myself from work on my days off. So some things that I do to kind of unwind are, spending time with my family, or spending time with my dog, or spending time with my friends, outside, socially distanced. And just if I have time to work on my hobbies, I like to, paint, or I like to sew a little bit, so just kind of keep your mind occupied with things that you like.
To keep my mental health in check, what I like to do is that I like to watch a lot of movies. I talk to friends and family on the phone. I play with my dog, and then what's been my trend lately is I'm doing a whole lot of online shopping.
I got vaccinated last December, so I got the first rollout of Pfizer in the US, which I'm really, really grateful for. And I wasn't scared at all. I was super happy to be getting it. I did have some side effects that felt like flu-like symptoms afterwards, but totally worth it.
Even though scientists and doctors have worked hard to make effective vaccines, there are multiple reasons why we still have to take precautions in order to keep everyone around us safe.
Everything the CDC says is true. Social distancing, at least 6 feet apart. I know we're probably getting kind of old of that statement, but it really works. And wearing your mask is probably the most important thing that you can do. And just reducing the amount of people that you spend with, and bigger groups. But mask wearing is the most important.